Hello, ladies and gentlemen. Thank you for joining me today in this valuable webinar here, or class, we should say, on herbal treatments for PMS. So we're not going to talk about home remedies as much or dietary guidelines. We're going to talk about herbal remedies, which are very effective for managing the symptoms of menstruation. Of course, this would include cramping, mood swings, breast tenderness, excess bleeding, anemia, hormone imbalances, etc. So we can see that there's many herbs that can address many of these areas, and we're particularly going to focus on those that help to manage hormones, and some that help with cramping and mood swings and even mild depression. So the mix of herbs can vary greatly for a woman. In fact, it's easiest and most effective to just formulate your own herbal tea from the herbs that are most suitable for you, because not every herb is necessary. But I have over the years formulated a tea, which we of course call PMS tea. And this is what we're going to go through today. You can see the qualities: hormonal balancing, relieves cramps, a little calming, and improves the mood. And we're going to go through most of these herbs today: red raspberry leaf tonic, passion flower, nervine, St. John's wort, mood uplifter, lavender is an aroma therapy type of scent and taste, white willow bark, which is for pain, and analgesic, wild yam, phytoestrogen, managing hormones, dong quai, another estrogen balancer, also called, and then chaste berry or tea tree berry. And then fennel seed is really just for flavor, feverfew for headache, and more. So we're going to cover those, and you can then maybe make your own formula in the future. That's what I would recommend. And in fact, I've given this tea to, hundreds and hundreds of women. And if they tell me that, oh, it really helped a lot with my cramps, but not with my mood, or, I got a little constipated from it, or whatever the side effects were that weren't suitable for them, then I just reformulate the tea for them based on their specific needs and their specific feedback. I could easily have 3 teas, one for Vata women who tend to be more dry skin and have more mood swings and more cramping, or I could make a tea and tend to be more constipated by nature. And then I could make one for Pitta women who have more irritability, pain, tenderness, and excess bleeding during menstruation. And then I could make another one for Kapha women who have more swelling and more depression. So I could customize this for at least 3 different categories of women, if not more. So I could have 5 or 6 of these various PMS teas, but I have one that I've made that seems to cover a lot of bases. And then I wait for the feedback from the client. And if she tells me it's wonderful, she thanks me for it. I usually ask her, well, what symptoms didn't it manage well for you? And if they mention, oh, well, I still felt anxious, I still felt depressed, I still felt swelling, I still felt cramps, then I can change the formula for her on the second time. But 9 out of 10, the women are happy with it. And you can see from my website, I've got a lot of testimonials of women thanking me, even mid-age 40-year-old women who say that they had the least menstrual symptoms of their entire life just with this bag of tea. Now, of course, there's many other factors relating to menstrual symptoms, and one, of course, is just overall health. The healthier a woman, the less symptoms they have, and we can see women's emotions and even health issues are very evident prior to menstruation. So often we can diagnose a woman by just asking about her menstrual symptoms prior to menstruation, and this will give us a large amount of information about her overall health. And many women have told me that when they started treatment with me, whether it was for inflammation, high blood pressure, cholesterol, diabetes, joint pain, etc., when we were done with the treatment by changing their diet, reducing the inflammation, managing their blood sugar, etc., then their menstrual symptoms decreased all on their own. Because many times I'll tell a woman, well, we'll work on your reproductive system after we address these more critical and urgent issues, like such as your pain or your insomnia or your anxiety. And of course, the diet has to change in all cases. Digestion has to improve in all cases. Elimination has to improve. Sleep will often improve. And then a lot of these menstrual symptoms are already gone after a few months of normal treatment, and the women refuse further treatment on their reproductive system because it's improved already. And in fact, many women have found that they, even after treatment for other conditions, because we're treating very holistically, improving a person's overall health, no matter what you come to me for, I'm going to look at you holistically. You may come to me to lose weight or to help with pain or inflammation or blood sugar or diabetes. But I will start with your digestion, your elimination, your eating habits, your sleeping habits, and I will manage any imbalances that I can and work on you holistically to improve your overall health as well as the specific condition that you've come to me for. And that holistic approach seems to be very effective to reduce menstrual symptoms and to increase fertility. As many women have told me, after treatment, they surprisingly became pregnant. And I think that's due to the overall improvement in their health. So that's always the first step, is to improve your overall health, improve your overall diet, address any other major issues in your life. And of course, if you're overly depleted woman, living on coffee, having smoothies, skipping meals, and you become thin and underweight, then your menstrual cycle could stop. I've had one client who just recently gave me a testimonial that her menstrual cycle stopped for 26 years, and after 2 months of treatment, it came back. But these are other subjects, and we're just going to cover today the herbs that are in my PMS tea and help you to understand them better so you could make your own formula that's suitable for you. Now, this tea usually starts to be taken 7 to 10 days before menstruation. If a menstruation is very irregular, you can still start taking it 7 to 10 days when you expect, or if you haven't had menstruation for a while, you can start taking it 7 to 10 days before the full moon. And I do, of course, have other formulas if the menstruation is absent, like in the case I just mentioned. And then I'm using Ayurvedic formulas for more conditions because they just have them. This would be absent or irregular menstruation or infertility. So this is a very effective formula. And if they have excess bleeding and a lot of spotting, we have another formula for that. We just don't use medical terms here. We just use, this common name, excess menstrual bleeding. So that's another subject. And like I said, I usually use my tea for just general menstrual cramps and discomfort before menstruation. And if they have more serious conditions, I use the Indian formulas, which I feel are more powerful for more serious female reproductive issues. So let's start with the first and most important herb here, which is red raspberry leaf. There we go. We got a pound of it right there. Organic, of course. And, we can see it's very little minty almost by taste. And it's from the mint family. And red raspberry leaf, a specifically American red raspberry leaf. It's very important not to pick red raspberry leaf from other countries because it is different than what we're talking about today. American red raspberry leaf. So it's astringent and sweet and cooling, and it's good for the blood, the muscles, the reproductive system, and helps with circulation and helps with digestion. So it's a astringent in action. So this can help with excess bleeding, but also can be a slightly constipating. It's an alternative. So that means it does cleanse and purify the blood, and it's tonic. So it's building You would, this also can be used for diarrhea, vomiting, excess bleeding, uterine bleeding, and prolapse of the uterus. You wouldn't want to use it in cases of chronic constipation, or at least balance it with other herbs and very high vata conditions for a person who's very depleted. Now, of course, in herbalism, we use it it raises the prolapse, stops excess bleeding or hemorrhaging, and tones the muscles and soothes the mucosous lining of the GI tract and reduces inflammation. But in general, we're using it here as a uterine tonic, and we're using it as the base of the formula. In fact, if you had no other herbs at all, you could just drink red raspberry leaf, 7 to 10 days before menstruation, and most women would find an improvement in their menstrual cycle and helping to regulate it. But it works much better in conjunction with other herbs. So I use the red raspberry leaf as a base. It's probably about 20-30% of the overall formula. And then there's many other supporting herbs, which we're now going to cover. The next herb I have in that formula is passion flower, which of course is a nervine, mild analgesic. And it does help with little anxiety. It's also in my relaxing tea and sleeping tea. You wouldn't want to use this too much during pregnancy, and it can thin the blood. So it's a supportive herb. It's not necessarily for menstrual cramps. It's just a relaxing, and I think there's maybe 10 or 15% of it in there. So it is more supportive. It's nothing to do with helping the hormones. The next herb I have in there is St. John's wort, another nervine, but basically we have it in there for its mood elevating qualities. Many people say it's used for depression, and I do have it in my happy tea, but I find other herbs in conjunction with just St. John's wort works very well, and St. John's wort by itself does not seem to be that effective for depression, except maybe mild cases. But with other herbs, it can be very effective. It's also analgesic. It's also a nervine, helps support the nervous system, particularly the myelin sheath, which can be used also in the case of MS, because it has a wound healing properties, particularly for the nerves. So it's in there to help out with the the mood, and it's also helping with the inflammation. And then there's lavender. Lavender is just there for the taste and the aroma, no other uses. Many women ask me, why is there lavender? And I said, because it makes it smell nice, tastes good. Then I put white willow bark, which of course is derivative of, not derivative of, but the original aspirin. So it has very much aspirin type qualities to it. We also use it in our pain tea and our headache tea. But it's analgesic, good for fevers, good for cramps, mostly lower back pain, and it's well known to help with menstrual cramps and headaches. Another herb you could use instead of white willow bark would be cramp bark. In fact, if I was out of white willow bark, I would just replace it with with cramp bark. The next one of the more important ones here is I have this wild yam root. This is wild harvested. And so this is a very important herb here. It's anti-inflammatory. And of course, it supports the female reproductive systems, but it balances hormones, not just sex hormones, but also adrenaline hormones. So it would be helping also with stress and cortisol levels. But because of its anti-inflammatory aspects, it helps with menstrual pain. It's even used during labor. And it is also used during pregnancy to help with vomiting and nausea. But its main use is for its hormonal balancing qualities. So that's a very important ingredient in this formula. Like I could replace the passion flower with any other nervine, but wild yam is very critical because it's known to help not just with balancing estrogen, but also progesterone and other adrenal hormones. So very, very useful herb in this case. So, and I want to say that, people think wild yam and some of these herbs, they have estrogen in them. No, they don't have estrogen in them. They are supporting your endocrine system to produce the proper amount of estrogen, cortisol, or progesterone. So they don't have estrogen. They have like phytoestrogens, the precursors, like the ingredients to make the estrogen, and helping the overall endocrine system. The next herb here, which is very important, that's in this formula, is dong quai. This is now a traditional Chinese herb from TCM, Donggu Dong, I think it's called. And it's an anti-asthmatic, anti-spasmodic, anti-inflammatory, anti-coagulant. So it stops blocking and bleeding. So it also can be used after menstruation as well to clean the blood. And it purifies the blood. And it also can help with constipation. Well, raspberry leaf is astringent and can be constipating. Dong quai can actually be used for constipation, which kind of probably neutralizes the effect of red raspberry leaf. So if a person was getting constipated from this tea, I'd reduce the red raspberry leaf and increase the dong quai. But it's very good at regulating the menstrual cycle, and it's strengthening the uterus. So it's often used before childbirth to regulate the menstrual cycle and strengthen the uterus, and it's most famous for helping to manage estrogen levels because of its phytoestrogen qualities. And like I said, it can be used after menstruation as well. And we also use it in endometriosis, ovarian cysts, and uterine fibroids. And this is because of its clearing qualities, its anticoagulant qualities. It helps it break down the fibroid and the cysts. Well, it's addressing the female reproductive system. And I also use this same dong quai in my menopausal hot flash tea as well. So the next herb, chasteberry, or vitex berry, it's called. There we go. And this is certified organic. You can see the little berries. It's a major hormone regulator and very important ingredients to this tea, but it also helps with blood and liver stagnation, so it helps to purify the blood. And like many of these herbs, it's also anti-inflammatory, and it's known to help both with progesterone and estrogen levels, and helping just to regulate hormones. And it's also known to increase female libido. So it's in my sexy woman tea as well. So a very important herb, though, chasteberry or vitex berry, and it also helps with cramping and mood swings and night sweats and hot flashes. So it's in my sexy woman tea, and it's also in my hot flash tea and in my PMS tea. So very useful tea, and it also helps manage your endocrine system whole and manage cortisol levels. So very, very useful. Now we'll just go back to that big list to remind you what we're going through here. For those who just joined, we're going through all those herbs in my PMS tea, which is a proven tea given to hundreds, if not thousands, of women and refined over the years to be very effective. So we went passion raspberry leaf, the uterine tonic, passion flower, the nervine, St. John's wort, the mood uplifter, lavender for taste and aroma, and it's a slight nervine, white willow bark for pain and cramping, and wild yam, dong quai, and chasteberry. All three are hormonal balancers and helping the whole endocrine system. So now we're just down to the last couple here. Fennel seed, it's just for the taste, no other, and it's a cooling. And then feverfew, which is for the headaches, and it's also in my headache tea. Black cohosh is listed there, but I have removed it from this tea. It's just still on the label, but it is in my menopausal hot flash tea. So once again, I'd like to say that the best is to understand each of these herbs very well. And of course, there's many other herbs that could be used. I mean, We didn't talk about blue cohosh, which I have. And there's mugwort, motherwort. I have a whole bag here of female reproductive system herbs, including red clover. So I could make a custom formula for somebody just from these herbs, as long as you know the herbs. And another herbalist could use different herbs. And then every woman could really use a different bag of tea. Like I said in the beginning, I tend to give out that tea first. And if the results are not there, then I just make a custom bag for the client. And that usually will take care of it. So I hope this helped you to understand that it's very easy to reduce these symptoms down to very little and almost no symptoms at all. I have to tell one joke here that a woman told me that she was drinking this tea, before her menstruation, 2 or 3 cups a day, which is what you need to do. Usually I tell them to, you can stop your relaxing tea or your heart tea or your other nervine teas, because it's a very relaxing tea too, and just drink 2 or 3 cups a day before menstruation. She said she was drinking 2 or 3 cups a day, kind of forgot about her menstruation and sat on the toilet and looked down and said, oh, there it is. There's my menstruation. So she had absolutely no symptoms at all and didn't even realize it was coming. Other women have said it's much less symptoms. And like I said, some women still have cramps or mood swings, and then we just, provide other herbs or change for them on their next cycle. But very easy to treat. There's no need for having these symptoms. There's no need to be suffering, but your overall health must be good. Your diet must be good, and you really should address other issues in your life first, like your eating habits, your diet, your digestion, your elimination. Resolve all these conditions first and become as healthy as you can, and then make or purchase a tea that's good for your menstrual cycle, or herbs. Chinese herbalists can do it, Western herbalists can do it, Indian herbalists can do it. Any good herbalist can help you with these premenstrual symptoms. So if you need assistance, or you would like one of my teas or me to make one specifically for you, I invite you to do an appointment, and I'll be my pleasure to help you. I wish all of you a good day, and God bless you, and thank you for your attendance, and please feel free to share this video with others who may benefit from it. Thank you once again.